So the American diet and the way that we eat in our country is generally not great. We tend to get a failing grade. And so in general, yes, we should be thinking about what we eat and we should be thinking about how it impacts our health. My name is Meg Bruening and I am the professor and department head of the Department of Nutritional Sciences at Penn State. So the new dietary guidelines for Americans were released today, and they're released every 5 years. And in these new guidelines, there are new recommendations around added proteins, meats, whole milk, but then there's also some things that have sort of carried forward from previous dietary guidelines, including eating a diet rich of fruits and vegetables, plant-based proteins, as well as whole grains and fibers. These dietary guidelines are so critical to public health. They are the foundation for all of our nutrition programs in our country. So school food served in school meals is based on the dietary guidelines. And so when they're updated to include things like whole milk and more meats, then that impacts the entire youth population in the United States and has significant public health outcomes. And we have seen how important the dietary guidelines are at improving health, particularly through those programs for those people participating in those programs. So there is an emphasis in the new dietary guidelines around increasing the level of protein. The Americans get more than enough protein, and there's really, to my knowledge, not a lot of good scientific evidence that the general public needs to increase their protein intake. And so I would caution people when they see that news to think about how they eat and how much protein they eat, and maybe that's one place where critical thinking is really important. Evidence has shown that saturated fat is harmful for heart health, and cardiovascular disease is the #1 killer in our country. And so when you look at these new dietary guidelines, I hope people look at it with a critical eye and knowing what years and years of science has consistently shown, that saturated fats, typically through animal proteins, is harmful for health. We also do get positive nutrients from those products, but it needs to be in balance in other things. And so I want people to also emphasize the other parts of their meal plan and thinking about fruits and vegetables and whole grains, things that are high in fiber, low in added sugars and fats and sodium. I think the other tool that I like to use is eat a rainbow. And so when you think about what's on your plate, think about all the different colors and try to incorporate new colors to your plate so that you're getting different kinds of nutrients. Plant-based proteins are a really important part of the diet for lots of different reasons, but they provide important proteins as well as fiber that are really important for health outcomes. Ultra-processed foods are thought to impact chronic diseases like cardiovascular disease and cancer. We do need more research on it, and that's one of the things that was highlighted in the dietary guidelines, but we do know that processed foods tend to have added components to them that may impact health. We don't really have a great understanding of exactly how that happens. And so perhaps these dietary guidelines are taking a preventative approach and saying less is more. In that sense, if we don't really know how they're impacting health, then we probably should try to avoid them. And so there isn't a consensus on how to define ultra-processed foods. When I think about it, I think about how many ingredients are on the label. And if there's 5 or more ingredients, or if there's ingredients that you can't pronounce, or if there's other things in it, then I would consider that more processed than something like picking up an apple out of the fruit section of the grocery store. We do know that foods that have fewer ingredients, like fruits and vegetables and whole grains, tend to be healthier because they're high in fiber and high in nutrients that promote health. With ultra-processed foods, because they come with that added fat and added sugar and sodium, oftentimes to help them to become shelf-stable, we know that those things impact health negatively. And so fewer ingredients in general helps us sort of give us a rule of thumb to understand how healthy it is.
Perfect.